Today we're going to be demonstrating an intradermal lignocaine injection, which is used to numb a cannulation area prior to IV cannulation. So we're going to make sure that we have our correct PPE gear, which is our gloves and our glasses, and then we're going to explain the reason why we're giving them this medication to the patient, and we're going to gain consent from the patient, and we're also going to check for any allergies to any anesthetics. Then we're going to go ahead and make sure that we have our equipment. So I've set up my equipment aseptically, so we have an alcohol prep pad, drawing up needle, a 26 gauge subcutaneous needle, our lignocaine, and a 3 milliliter syringe. Then we're going to go ahead and we're going to clean the site. And we're going to clean in small to large concentric circles near the IV cannulation site to ensure sterility. And then we're going to make sure that we have our right drug for the right patient and that it's not over the expiry date. So we have our lignocaine, which is 50 milligrams and 5 milliliters and expires 2020. I'm just going to get my offsider to check this as well.
Yes, this is lignocaine, 50 milligrams and 5 milliliters, expiring in 2020.
Thank you. Okay, and then we're going to go ahead and we're going to attach a drawing up needle to our syringe. Just making sure that we do it aseptically. And then we can draw up anywhere between 0.5 milliliters to 1.5 milliliters, as this is an adult patient. We're going to attach our 26 gauge subcutaneous needle, and anything smaller than a 25 gauge can be used for this. Okay, so we're just gonna say sharps out before we remove the cap, as this is good sharps etiquette. So sharps out, and then we're going to warn the patient before injecting. So we're just gonna say sharp scratch, and we're going to insert at 15 degrees or less. So sharp scratch, going in near the IV cannulation site. And then we're going to aspirate to make sure we're not in a vein, which is not, so we're good. And we're slowly going to administer the medication, watching for any bleb formation. And before we remove the needle, we're just going to maintain our good sharps etiquette, and so when we withdraw, we're going to say sharps out, and then we're going to pop it straight into the sharps bin, so sharps away. And then we're just going to wait for 1 minute before IV cannulation. So while we're waiting, we can document the date, the time, the drug, the amount of drug we used, and the route. And we're also going to watch for any allergic reactions, such as redness, swelling, or any rashes forming.